where you're having that pushing, where it's compressing, okay? So what we're gonna do is we're gonna put a towel roll under your hip here, and that's gonna open that up a little bit. So can you, we're on this area here, can you see how that opened that up?
Yes.
Then I'm gonna rotate your upper body a little bit, and can you see how that's gonna open it even more? And then we're gonna bend your knees a little bit, and you see how that's gonna get that last little bit for you. So that we call positional traction. So that you're gonna do at home whenever you're feeling that kind of numbness, that pain down this leg to kind of gap it a little bit.
Okay.
Does that make sense?
Yes.
Okay. And you're gonna wanna stay there for 5 to 10 minutes unless, of course, you get an increase in your symptoms. You don't want any increased numbness, tingling, that kind of pain, that kind of stuff, all right? So the roll towel will really vary on the person as to how much we want to gap. So for you, I think I want to do about this much. So we're going to feel for you here. I'm going to have you scooch that way just a little bit. Bend your knees up for me because that helps your back. And then you're just going to roll onto that, okay? Yeah. So at home you can already have it placed there or you can put it under there. Okay? Does that feel okay?
Yes.
So now since you're here and I can kind of isolate it out, so I would feel in here for her, and you guys will do this in the ortho class, but there's no reason why I can't show you here when I'm walking around when you're trying. So we're just gonna, I'm putting my finger in between the vertebrae. So I basically got my fingers here. And I'm gonna move her and I'm gonna feel until I get to that spot where I want to open that up. And so we know that, what, L3, L4 is about the iliac crest, right? So I know that's about where I want to be with her. So I can bring her legs up. I'm going to kind of just see until I get that space to gap a little bit, just so I kind of know where I want to be. So I'm going to say about right here. And don't worry that you guys aren't going to know exactly, but just to kind of start playing around with that. So I'm going to take her upper arm, and I'm going to come underneath, and I just want you to relax. And I'm just going to pull the shoulder forward. And then you're just going to let that go back. Just relax. So that kind of locked her whole upper spine, right? Kind of like we showed on the model. Then she's going to just play around a little bit. Oh, that feels really good right there, doesn't it? Mm-hmm. Yeah. And that's her spot. So she's going to put this leg right there. Like a good patient. She doesn't want to put it there, but she's going to behave. And that's where she's going to be. So then when she goes to do this at home, so go ahead and roll back off. I always have them come here, and then I usually have them do like just some sways or something like that until they get up. I want you to put yourself in that position, okay? Okay, all right. I'm just here to guard you in case. And then you're just going to kind of mess around with it. So she knows, see how quickly, and then she would just kind of play around with her hip until she gets that exact gap. So basically what's happening here, we're just going to put this on you, sorry. Okay, we've moved her forward here, and we've moved her forward here, and you can see which levels is doing the best right now. These two right there, right? So then in order to get more down, I'm going to have to put her into more rotation up here and a little bit more there. Okay? So it's a wonderful home option for her. And then if she was that person who was telling me the extension just does not feel good to them, but I need that gapping, I'm going to take that out. She's going to be that one where you're going to have her bring one knee up, put your hand underneath so that you don't hurt your knees, and then your other one, and then she's just going to pull up. And we can see that that's going to gap, right? And that's our double knee to chest, right? And then I'd have her hold that nice and gently, minute, 2 minutes, as long as it decreases her symptoms, and then she's slowly going to let them come back down. Okay, any questions on any of those? Yeah.